Let's talk brains today, and let's talk a specific part of the brain or a specific part of each neuron cell. And in fact, almost every cell in your body, um, the mitochondria or the mitochondrion individual. And what the mitochondria are, classically, they're taught to us to be the powerhouses of our cells in biology 101. We're taught that, and that is true, but they're, as we've talked about before, they're much more useful than just that and play many other roles. But this is a healthy mitochondrion, and healthy mitochondria drive healthy humans. As our mitochondria age, we decline. And there's a mitochondria theory of aging that is the best supported hypothesis of aging and why our health declines and why we age, etc. And it's basically, as mitochondria go, so do we. And so yes, they do produce the ATP energy for us. They also have genes that influence our immune system in our inflammatory states. They are found in every cell pretty much except our red blood cells. More highly metabolic cells have more mitochondria because highly metabolic cells require more energy to function. So the heart is loaded with them, skeletal muscle is loaded with them, the brain is loaded with them. And we can increase our numbers through different nutrients and exercise. And so, again, healthy mitochondria are key to global health, but today we want to focus on the brain and on neurological disorders and diseases and look at two therapies that can improve mitochondrial health and therefore improve things like Alzheimer's disease, stroke, Parkinson's disease, traumatic brain injury, depression, etc. And so here's a picture of healthy mitochondria. Healthy mitochondria protect the brain, and the healthier your mitochondria, the less likely you're going to develop Alzheimer's, stroke, depression, Parkinson's, or brain injury. As things build up and accumulate in our life that damage our mitochondria, like free radicals or oxidative stress, like in this case, inflammation in the brain, poor electron transport, poor blood sugar handling, poor oxygenation, calcium imbalance, those things will damage our mitochondria, which damages our physiology and increases damage to the brain and likelihood of neurological disorders. So we want to do all that we can to preserve our brains since we only get one. And there are many things we can do for that, and we've talked about them, some of them many times, like nutrition and physical activity and stress reduction and sleep. And those are lifestyle things that you can choose to do correctly or incorrectly multiple times every day. But there are therapies that are being researched and are highly researched and continue to be researched that also promote brain protection, brain health, and then recovery and healing in neurologic diseases. And those two things we want to talk about today are methylene blue and photobiomodulation, which is a big nerdy term for low-level laser therapy, or red light lasers and near-infrared lasers. And so if we dive into that, first we want to understand how the mitochondria work to produce energy for us. And in understanding that a little bit, we can understand why and how the laser and or the methylene blue help us, and why using them together can be synergistic. So this is a picture of zooming in from that green mitochondria we saw earlier. If we zoom in, well, let me go back to it just for reference here. So here's the picture of the healthy mitochondrion, and you can see that you can see here that it's got two membranes. It's got this outer membrane that just looks like the oval shape, and then inside it's got these cristae, which is fancy for the fingers, or the inner membrane has all these fingers. And it has the fingers because that increases the surface area of that inner membrane. So there's more opportunity for more energy and things to be produced than if the membrane were just circular like the outer membrane. So if we zoom into that and just take a look at the outer membrane and the inner membrane right next to each other, it'll look like there's two membranes. Here's the outer, here's the inner. Okay, so let's actually label, oh, we've got it labeled right here, outer membrane, inner membrane, and you've got this intermembrane space between the two. And the reason those two things are important is because in the inner membrane, you've got these, what's called the electron transport chain. And basically it's a bunch of nerdy biology happening where we're using protons and we're using electrons, and they're bouncing around between complexes 1, 2, 3, 4, and 5. And ultimately we produce ATP, which is adenosine triphosphate. This is the energy currency of our cells. So when we need energy, if you're tired, if you're brain fog, if you need a nap, if you're hungry, and you say you need energy for any reason, what you're really saying is I need ATP and I need my mitochondria to make it for me from whatever raw materials you're going to provide it with, the oxygen and the glucose and things that are broken down to eventually lead to this. And so this is the picture that shows how ATP is produced, and a couple of things that are important to know here is this can be impacted by nutrition. In fact, it can't occur optimally without nutrition. Why? Well, because this right here is vitamin B3. This one right here is vitamin B2. And then right here you see coenzyme Q10. And then also, which isn't pictured here, but you need iron for this process to work and some other things. So if you've got an issue with iron or with CoQ10, hey, taking a statin drug, and that statin drug is known to cause coenzyme Q10 deficiency. Well, since I started the statin drug, I've been tired, or I've had muscle pain or achiness or forgetfulness. Well, if you're lacking that CoQ10, you can't make the ATP optimally, and those muscles may not work well, or that brain may not work well. If you're deficient in B2 or B3, again, complexes 1 and 2 aren't going to function properly. So there's lots of ways where we can use nutrition to positively influence this, and if our nutrition is not good, then that will negatively influence this process. And like we said earlier, if we're not producing energy well, then that can negatively influence your entire physiology potentially. And so we need this to be firing on all cylinders. As part of that process, when it is firing on all cylinders, there is about a 2% production of reactive oxygen species, which are also known as free radicals. And free radicals, if you're out there and you've ever read a health blog about taking antioxidants, or you bought a supplement with antioxidants in it, what antioxidants do is fight oxidative stress. So the ROS is the pro-oxidants. Those are the things that will damage tissue. Antioxidants are taken to try and combat this and kind of offset these or inhibit these. Okay, so in normal mitochondrial physiology, we are going to have some reactive oxygen species production, but that's okay in a normal healthy individual because we've got processes that offset that, and it's no big deal. But if we become unhealthy and have factors that are ramping up this reactive oxygen species production, that can lead to, in the brain specifically, neurodegeneration. Okay, so things like Parkinson's and Alzheimer's, and other pro-inflammatory nervous system issues can also lead to nervous system degeneration. And the inflammation and oxidative stress are, I explain it as they're like having two kids who aren't twins. They don't look exactly the same, but they'll both wreck your house, right? In this case, they'll both wreck your brain, and both can be caused by mitochondrial dysfunction in this process going awry. So we don't want too much of this produced. If we have just enough of it produced, that's fine, that's normal physiology. So with that understanding, hopefully there's some understanding that came along with that description. But with that understanding, we now want to look at, okay, if that if our mitochondria look like this whole picture, which actually includes this part here too, then we've got increased risk of brain disease because we've got electron leakage that leads to brain diseases like Alzheimer's, depression, Parkinson's, an effective traumatic brain injury, etc. Well, what do we do for that? Well, of course, we want to make sure the person's B3, B2, CoQ10, iron, we want to make sure their nutrition's on point. We want to make sure their oxygenation's on point. We want to rehab them properly. But are there things we can do to accelerate that recovery? And then once recovered, are there things we can do to promote further brain health? Yes, this study is looking at the methylene blue and the laser as therapies to help us accomplish that. So if we go look at the images for those two things, we can look first at the laser picture somewhere down here. Oh no, well, let's look at methylene blue first. Okay, so first, what is methylene blue? Let's answer that question. Methylene blue is what makes your blue jeans blue, and it's what makes your blue shirts blue. Methylene blue is a textile dye, but it is also an FDA-approved medication that first came out over 100 years ago for malaria. It was actually the first malaria treatment. It was used in World War II on the Pacific Front to help combat the malaria that our Pacific Front soldiers may have faced in the third world countries while they were inhabiting, while working to battle Japan. And it was the anti-malaria drug. And so it is very effective. The reason that, they moved to other anti-malarials like chloroquine is because methylene blue has a side effect of turning your urine blue or green. And the soldiers didn't like that, but it's benign. It just makes your urine blue or green. So if you know that and can expect that, then it's no big deal. That's a little bit of history on it. But it is FDA approved for malaria, for methemoglobinemia, and for cyanide poisoning. Beyond that, though, as time has gone, it's been studied for other things. So it's got beneficial effects on psychosis in preclinical and clinical studies. In a randomized double-blind placebo-controlled trial, low-dose use was able to increase functional MRI activity for short-term memory and memory retrieval in Alzheimer's disease. So memory and brain function there. It can easily cross the blood-brain barrier and donate electrons to the mitochondrial electron transport chain, like we were just showing you. And so if it can donate electrons, that allows you to make more ATP more efficiently. And because it readily crosses the blood-brain barrier and has a strong affinity for the mitochondria and acts as an antioxidant, the FDA approved methylene blue to be routinely prescribed as an antidote for treatment of poison-induced methemoglobinemia. So it's used for multiple different poisonings, and for malaria, it's being studied and shown to improve energy production in Alzheimer's and Parkinson's and the various diseases we're talking about. So we want to consider this as an option for neurologic disorders. So here's how it works specifically. You've got the electron transport chain now, same picture we saw earlier, where, we're going complex 1 to 2 to 3 to 4, and then 5 pumps out an ATP. Well, that complex 1 and 3, sometimes electrons leak out and produce increased oxygen, which gets turned to reactive oxygen species. And we said those free radicals can increase the brain damage if they build up too much. Well, in a damaged brain, say head injury or the Alzheimer's or Parkinson's, we're seeing more inflammation, more oxidative stress. So how methylene blue helps is it provides a pathway that skips this leakage here. So you can see methylene blue reroutes the pathway of electron transport. Instead of going that way, it'll come this way through methylene blue. And by bypassing that, it efficiently skips the leakage and the reactive oxygen species production. So you get more efficient ATP production without the risk of brain damage. That's huge, especially in a brain that's already damaged, such as Alzheimer's, Parkinson's, head injury, depression, etc., major depressive disorder. So specific for use in neurodegenerative issues, this is how the methylene blue works. And then in looking at the laser, we've made multiple videos on laser, and I can connect to those here. But a quick reminder, low-level laser therapy has been used for over 50 years. It's using red light or near-infrared light to have an impact on your biology. And it's used in everything these days. There's studies coming out every day on it. I've got lasers in my office. There's chiropractors, there's physical therapists, there's all kinds of doctors around that have and utilize low-level laser therapy. These are non-burning lasers. You don't feel anything when you're applying it unless you've got it over a hairy area. Sometimes it can feel a little burny in your follicles over dark hair. But other than that, it's a painless treatment, and it penetrates the tissue depending on which wavelength you're using, red or near infrared. Near infrared goes deeper, up to 5 to 7 inches deep, and impacts the tissues by, again, influencing the mitochondria, increasing ATP production, oxygenation, reducing inflammation. And so we can see a picture of that in the mitochondria here. So here we are again with our mitochondrial membrane, and the laser is up here. PBM is the photobiomodulation. That's the low-level laser therapy. So they're shining red light in, from the surface of the body, and it's hitting your cells and the mitochondria inside your cells. And the laser specifically increases complex 4 function by dissociating nitric oxide from it. And by doing that, it increases the complex's function and increases a little bit of reactive oxygen species. But that transient increase in the reactive oxygen species here has a hormetic effect, and hormesis is that which doesn't kill me makes me stronger, right? So a hormetic effect, the slight increase in reactive oxygen species causes genetic upregulation of cytoprotective signaling, which is basically we need to put fires out. So we see this little bit of fire, we need more fire extinguishers. So you get this big anti-inflammatory effect, which blocks, again, the free radicals and the inflammation. So the laser is an external use of increased function of the electron transport chain, blocking inflammation, oxidative stress in the brain. The methylene blue would be an internal use. You take it and it provides that roundabout pathway to skip the reactive oxygen species formation of ATP production. And so using these together, 2 different pathways can have a synergistic effect and positively impact various neurodegenerative issues. And this study goes on to show, wow, it's way up here, but here it is. The impact here of, I missed it, sorry. It's lower than I was, there it is. So the summary of the impacts of methylene blue and laser on these disorders. So I'll let you download the paper and look at them yourselves, but what studies are finding is the things we want to see and the things we described today. Improved blood flow, improved energy, improved oxygenation, decreased inflammation, decreased damage, in Alzheimer's, reduction in increased ability to clear out beta amyloid plaques. The beta amyloid plaques are the pathognomonic sign of Alzheimer's. Oftentimes they're going by that. So big changes for pretty much for safe treatment. So laser, like I said, what should you worry about with laser? One, is it contraindicated? Well, you don't want to look at it don't shoot it directly in your eye. Obviously, you don't want to do that with any laser, but otherwise, lasers can be used safely for all kinds of issues. I use them on myself, on patients, on kids all the time. And again, it could burn a little over dark hair. Like if you have black hair and you're trying to do it on your head for some neurologic reason, it could burn a little bit. If you use near infrared, that does not burn as much. And then if we look at methylene blue has a couple contraindications. The largest is if you have kidney failure, you don't want to use high dose methylene blue, or you might not want to use methylene blue at all if you have kidney failure, because it reduces circulation to the kidney. If you've got glucose 6-phosphate dehydrogenase deficiency, that's relatively contraindicated, so you may or may not want to use that, and then be between you and your doctor. And how do you know if you have that? It's a $6 blood test through LabCorp. You can run it, and if you're normal, then you don't have to worry about that. Other things to know: if you're using methylene blue and you go to your doctor's office and they use a pulse oximeter to look at your oxygen saturation, the methylene blue could falsely lower that. So, you may not have an oxygen issue. You may just be on methylene blue. So remember that. And then if you're on a SSRI medication such as Prozac, say a antidepressant, methylene blue has natural monoamine oxidase activity. So that, combined with the SSRI, potentially could raise the risk of serotonin toxicity and serotonin syndrome. So again, don't go take this without speaking with your practitioner and doing the due diligence to make sure you're not one of the people who are contraindicated. It is a relatively safe thing, but you want to be sure that you're safe and that it's safe for you. And so a $6 blood test and a medical history and things could help you rule out those things and know whether you're safe to take it and at what dose. So if you or someone you love is dealing with neurodegenerative issues like Parkinson's or Alzheimer's, or neuroinflammatory issues like head injury or major depressive disorder, these are two readily available, pretty easy to get, safe therapies that can be used in isolation or together or adjunctively with whatever other treatments you are doing for those conditions. So let's open that up.
With the red light therapy, is there a specific wattage or whatever, something that you're looking for? Because there's a huge range of pricing and product. And so if somebody doesn't have thousands of dollars to spend, what should somebody look for? Because there's a huge range and companies who will sell you whatever you are willing to pay for.
That's a good question. And really, I mean, theoretically, you could use a red laser pointer and maybe eventually get therapeutic benefit from it. But that thing's so weak, you'd have to hold it there for so long. And hopefully, and you'd probably need your issue to be relatively close to the surface so it could get there, that you're better off to spend more money and have more power and more penetration and need to treat for a shorter time. So generally, unless, let's just assume we're talking about good companies with legit products. Okay. The more power, the more effective in the shorter amount of time. So, the therapeutic lasers tend to be around the 1,000 milliwatt level. And so having that kind of power will help you be able to treat on the order of, 5, 10, 20 minutes, depending on what tissue we're doing, what we're trying to do, versus the weaker they are, you'll have to treat longer, and they may or may not reach the depth that you are trying to reach. So does that help?
I think so.
And then the wavelengths, again, the red light will go the visible light, the red light, doesn't go as deep as the near infrared light. So near infrared can penetrate our bodies, again, like I said, 5 to 7 inches. Whereas the red light is less than that. So if you were using a laser, both have been shown to penetrate and reach into the brain. Because your brain isn't, that many inches away from your skull or from the surface. So, but if you were looking more to reach the center of your abdominal cavity and hit, say, a pancreas, or or influence the microbiome, you may need, one that can go deeper.
So
what's the difference between the red light? Oh, sorry.
That's okay.
Yeah, same. Go ahead, Jessica.
What's the difference between the red light and an infrared? I've been in an infrared bed before, but then I started hearing about red light therapy. Is it the same thing, or what's the difference?
The difference is the wavelength. So you've got a visible spectrum of light, right? Roy G. Biv, the rainbow. So you can see. Hold on a second. So if we go, so we've got red light, say, that's visible, and then I'm gonna make it orange just so you can see a difference. Then we've got the infrared spectrum after that, which we can't see. Okay, so the red light spectrum is gonna be, say, let me change my color there. Red light spectrum is gonna be 470-ish, 7 to 700-ish nanometers in wavelength. And then the infrared, you have near infrared and then far infrared. So NIR is near infrared. Why am I using my mouse when I have my pen right here? Sorry. So you've got NIR, near infrared, and then far infrared. And the therapeutic is the near infrared. So, if we're talking about saunas, there's saunas out there that are far infrared. Those feel warm, but the far infrared isn't really doing anything for you in terms of light penetration, whereas a near infrared sauna is giving you the heat, but also this is penetrating 5 to 7 inches into your body and giving you quote unquote laser therapy that way. So they're both therapeutic. The different wavelengths affect different tissues differently. So it's just depending on what we're trying to do.
Okay.
And now,
thank you.
You're welcome. And now there's actually there's blue lasers out there. There's purple lasers out there. And again, the difference, Jessica, would be purple. These are a different wavelength. These are shorter wavelengths. And so these have different effects than the reds and the near infrared. So the blues for wound healing, blues and purples are used a lot for wound healing type stuff. They're doing better for wound healing than red and near infrared. So it, again, depends on what we're trying to accomplish.
So just for kind of overall health, a near infrared sauna would be the way to go if we were going to get one of those?
Yeah, I mean, if you can get one, the most common are far infrared, but those are not doing what you're wanting them to do. If you're
Okay.
interested in what near infrared does. So yeah, if you want
Okay.
these types of therapies, you want a near infrared sauna.
Okay. Thank you.
Which are harder to find and probably more pricey, but again, they're more therapeutic. Sarah, did that answer your question?
Well, I just know that one of the gyms I belong to has it's not a bed, you stand in it and it has the red light therapy. And I'm so curious as to what kind it is now that I just learned so much more about it. But that would be an inexpensive solution if it is correct, if it is the right kind. Because
Sarah, are you talking about Planet Fitness by chance?
Yeah, they do have one at Planet Fitness. Yeah.
So I was using it and I did ask them to find out. They said it was between 600 and 700 in
Nanometers.
the booth.
Okay.
of near infrared. I don't know if that's what you have found out, but when I was going into the booth, that's what I was told.
Okay. Yeah, that was my question. Thank you.
Yeah, so if it's a red light bed, you know, and it's in that 600 to 700 nanometer range, then that's a therapeutic wavelength. So then the question is you know, is it enough power, and how long do you need to be in there to get the benefit? I've used a bed in Charlotte. There's a, what's it called? iCryo, and they have a red light LED bed. It looks like a tanning bed, but it's red lights, and you know, you can pick recovery and all these different settings. And I did it just to try it out and, you know, experience it. But you know, I don't know. I think for general health, that's good. I think for if we had a more specific issue, you might be better to do, you know, a therapeutic laser pointing directly at the brain, that sort of thing. But yeah, in general, it's good.
And how would you measure success? Like, what would you use for a marker to know if you started somewhere and where you would end up?
If we were talking about um, a neuro inflamed patient,
Mm-hmm.
you would want to have objective indicators. So, you know, you'd want to do an exam on the person and see, and maybe have some labs, and, you know, so it's not just like, hey, let's shine a laser and I hope they tell me they feel better. We'd want to be able to say, okay, there's these markers that change their memory improved here. Maybe these eye movements changed here. You have to have some, you know, something hard to base it on. Does that make sense?
It does. My dad has dementia, and the
Yeah.
neurologists that I bring him are so old school. It's just not even funny. I can't even.
Yeah. So like up here when we were talking about that Alzheimer's paper, you know, they were using they had functional MRI, and they're seeing that those areas change in regards to where short-term memory and memory retrieval occur. So they would see the brain light up more in those areas on functional MRI. If your dad's got dementia, you could say, okay, he filled out the MMSE, the mini mental status exam, where they make him draw the clock and draw the cube, and, you know, what day is it and what year is it and all that. So that's a validated mini mental status exam where they can say, okay, we're going to use this to diagnose him with put him on the spectrum of, you know, healthy to mild cognitive impairment to outright dementia. And so say he goes in and he scores a 21 on that, and just for the purpose of this conversation, all you do is laser his brain in certain areas hoping for a change. Then after a treatment period, you know, a couple months, you have him fill it out again, and he's a 13. That's a significant improvement in the MMSE. And you're probably also saying, hey, I've noticed he's stuttering less, he's asking the same question less, he remembers me more, that sort of thing. So you want to have as best we can, some kind of objective indicator, and then hopefully, you know, patients or caregivers are telling us that there's subjective improvement and quality of life improvement as well.
What about other organs? You know, I have AIH, and what about the liver?
Yeah.
Okay.
Liver. Yeah. I mean, it's anything.
Okay.
If you go to pubmed.gov and type in, you know, photobiomodulation and liver, photobiomodulation and dementia and whatever, there's probably studies. I mean, there's papers every day coming out. So the reason you could use it anywhere is because all those tissues need ATP to function. They need energy, right? So if we're increasing the energy production of the liver can better do what the liver does. Or if we're trying to heal the liver, we can heal the liver more efficiently.
Sounds good.
Does it matter if you're dressed or not?
Yeah. Yeah, absolutely. So it's best to be, and great question, it's best to be directly on the skin. because if you're dressed, the clothes, you know, it's light therapy, so clothes will interfere with the light photons. And obviously, the darker the clothes, the more they'll absorb it. So the less that hits your body and has its therapeutic effect. So yeah, you want to have it directly on skin, and that applies to if you were naked, but it's 3 inches from your skin versus directly on your skin. The direct on the skin is going to be better because, again, there's less ambient air that the light could reflect off of and not penetrate. So you want to have it as best you can, you know, directly touching you.
So the booths, for instance, that you walk into
Mhm.
at a Planet Fitness, I mean,
Yeah.
you're not going to go in without any clothes on. So I'm thinking maybe it's not
probably-
really working.
Probably not, probably not as beneficial as it could be.
Right.
Whereas like if you at an eye cryo, if you go lay on theirs, I mean, you can strip down to, even if you just kept underwear on, now you've got all that much more exposure though. And you know, you're laying on your back, so you're directly touching the whole back half of your body. And then the top half that closes over you isn't touching you, but, you know, it may be closer to you than it is at Planet Fitness. I don't know. I haven't been to Planet Fitness's booths,
Okay.
but yeah, ideally touching you.
They're private. The booths are private, so you could be naked in there. But if you're, I was thinking about it as a smaller person, I'd have to back up to the walls or something because I don't take up that much because it's a pretty big tube
Yeah.
kind of thing. But you're standing, at least the one I went into,
Yes.
I was standing up, but I took all my clothes off, girl. I was like, I
You
want
did.
every yeah.
Okay.
Yeah.
Okay,
And
good to know.
yeah, so if you're gonna do that, take them off and then put your front or your back against it. So
Yeah.
so at least one side is getting the contact.
Yeah. But I don't remember the time. It was some years ago, and I don't remember the amount of time that you're allowed to be. And they put a timer on there. I want to say it's got to be 10 or 12 minutes, though. But it's a lot of information. It's good. It's good to know kind of what our options are.
Yeah. Yeah, I'd say exploding field, but it's been exploded for a while. It just continues to grow though. So check it out for sure. And then I'm sure you guys have seen the different products for like wrinkles or acne, like the Juve or the different masks that they market to do the red light therapy for skin and things. So yeah, it's out there and relatively mainstream.
There's a place down off of Park Road called Cure Spa that has infrared beds. That's where I went. When I went down there, it was more to get, I did like a lymphatic massage beforehand.
Mhm.
And then they put me in there for like 30 minutes. And that was basically to help remove the toxins, I guess.
Mhm.
But it was, the first time I did it, I got a little lightheaded when I got out because it was pretty hot in there.
Yeah.
I got used to it.
I wonder if it's near infrared. That would be the question I'd want to ask it.
Yeah, I'm not sure. And
Go ahead.
yeah, I'm not sure. And I can't remember even how hot. I know they gave these pads and they dipped them in castor oil, I think, something. And they put them like over my liver and underneath my arm. And that was supposed to help even more get the toxins out.
Gotcha. Okay. Well, hopefully it worked for you. Those are castor oil packs are definite detox strategies. And so if they're,
Yeah, I had never heard of that before.
oh yeah, that's been used for a long time. So there's a lot of history behind that and a lot of research behind castor oil packs too.
Castor oil is like duct tape.
Yeah. Yeah, it is. It is. Yeah. I mean, it's one of those things that like they've been using for eons and now science is like, yeah, it works. It's like, yeah, 2,000 years of traditional Chinese medicine is enough evidence for me, but I'm glad you finally put a paper out on it. You know, so we're so like, where's the science in our culture that we ignore 2,000 years of history? until there's a paper printed. It's like, well, no, because there's some things, even the way that we do science, like some things aren't going to show up as helpful in the way that we do science because their gold standard for evidence-based doesn't, that's built on proving that a drug works with a single mechanism. And a lot of the things we use, like castor oil has systemic effects, turmeric's going to have all kinds of systemic effects. So to say that it doesn't work when you're looking at just one pathway and then say, oh, turmeric's useless, that's a wives' tale or whatever. It's like, no, maybe the science you used to evaluate it was useless. So anyway, good questions. Anything else on this?
I have a question about, you mentioned the CoQ10 and being on a statin. So regarding memory loss again, talking about my father being on a statin, would you recommend, and generally speaking, a CoQ10 supplement to help?
If you're on a statin drug, absolutely.
Okay.
Yeah, absolutely. I mean, it's known, like that's indisputable. Like even medical doctors should be saying that by now.
You're not.
If they're not, they're way behind. But yeah, that's like well known. It's probably even in the insert. But yeah, CoQ10 statin drug nutrient deficiency of CoQ10 with statin drugs is
No, the argument I got into with him was not an argument, but discussion was, he was saying that statins do not cause memory loss. And I had all kinds of clinical data, and he said, no, there's new data out since then. So anyway,
well,
I argue with doctors a lot.
Yeah, if you're driving CoQ10 deficiency, you're going to have memory loss eventually. So there's a great book called Statin Drug Side Effects and the Misguided War on Cholesterol by Dwayne Graveline. And he's a medical doctor astronaut. And he wrote the book, and I read it years ago, like 2006 maybe. It's a great book, and it's his own account of he went on a statin drug, and he developed transient global amnesia from it. So basically he'd be driving to the store and he would wake up and be like, where am I? What am I doing? And so it was the statin drug that caused it in him. So he wrote this book saying, hey, the whole cholesterol thing, statin drug thing's a farce, and the war on cholesterol is a farce, blah, blah, blah. But anyway, his major symptom with the statin was that transient global amnesia. So basically the transit part is once in a while, randomly, he's gonna kind of wake up and say, where am I? What am I doing? How'd I get here? Whereas more commonly, it's people are saying, I have joint pain or muscle pain or fatigue, and that is CoQ10. So the transient global amnesia and the memory loss would be a worse presentation of the CoQ10 deficiency than say muscle soreness or joint pain or fatigue. But yeah, it's well known. So if that doctor isn't aware of statins inducing CoQ10 deficiency, then
well, I can just ask for some labs to be done and just,
yeah, you can test it.
Yeah.
Yeah, I mean, and as a piggyback on your question, okay, because then you go, well, what should I take? All right, so coenzyme Q10 is right here in the chain, and it's the ubiquinone form. Okay, so when you're looking at CoQ10 supplements, there's ubiquinone and there's ubiquinol. Ubiquinol is more expensive, and a lot of times gets converted to ubiquinone for the body to use it. So don't spend extra money on the ubiquinol. Just get ubiquinone.
Okay.
The ubiquinone form of CoQ10, and it's 100 milligrams, 200 milligrams. It's you're good. That's totally safe. I was at a conference in October in Utah with the doctor who literally wrote the book, Drug Induced Nutrient Depletion Handbook. James Laval, he's in Chicago, and he says he puts his patients on 100 milligrams of CoQ10 for every medication they're on. So he's like, if my patient's on 8 medications, they're getting 800 milligrams a day. So
Wow.
that's just an anecdote. That's not advice to you, but just to see like that guy, that would be considered a very high dose, and he's not worried about it. So and part of the reason for that is because so many drugs deplete CoQ10, not just statins. So the likelihood is if you're on a statin, you're probably on other medications that deplete it too.
Mm-hmm.
I just have something to add. Zocor, which is for cholesterol.
Yeah, it's a statin.
Okay, that was the issue that a surgeon friend of mine had with his amnesia, and he figured it out himself. And I had a conversation about that today.
Interesting. Yeah. So so his statin caused the amnesia for him as well.
Yes, and no one could figure it out.
Yeah.
He figured it out, I guess, from research. And another friend of mine has been having this same amnesia issue, and I sent them a message today. What cholesterol drug or statin drug are they on?
Yeah. Yeah, that's a great thought, and you might give them their brains back. And I've made videos on statin drugs before, and so I can link to it here. But so statin drugs, just to finish this up, statin drugs are the technical thing they do is they block HMG-CoA reductase. They're called HMG-CoA reductase inhibitors. And so if we say, let's see, cholesterol. If cholesterol here, if this is the final step, okay, we're going to start with vitamin B3 and some other inputs here, and we're going to go through many steps, and at step number 32, we're going to have cholesterol, okay? Well, at step 3 is what's called HMG-CoA reductase. So this step 3 here, this is where the statin blocks. Okay, so the statin comes in and blocks step 3. Well, guess what? Down here in this pathway, we get vitamin D, and we get estrogen, and we get testosterone, and we get other things. So if we're choking this thing off at level 3, so that we don't get cholesterol down here at 32, well, we're also decreasing outputs of these things, right? And so why do statins have such broad side effects? Like the CoQ10 deficiency is just one, but if we're cutting off this pathway so that we don't raise cholesterol, well, our fat soluble hormones are all taking a potential hit because they all need a cholesterol backbone to be produced.
Yep. I wanted to just say to you, preach.
Yeah, and so again, on the commercials, they say, or it's in the fine print, if 6 months of aggressive dietary and exercise lifestyle change doesn't work, try a statin. Except they never say that in reality, right? They just say, hey, your LDL's high, here's a statin, you're gonna die of heart attack or stroke unless you take it. And you're like, oh no. It's like, well, if you take the statin and don't change your diet and don't go move, you're gonna die with lower cholesterol. Big deal. Like 35 years of research on statins, people are dying at the same rate of heart disease and stroke just with lower cholesterol. So it's not even the cholesterol that's killing them. But that's a story for another day that I've made a couple times. Just check out the cholesterol videos on my YouTube channel.